Our second presentation will be held by Serge Morand, professor of Kasetsat University. So please welcome him to the podium with a big round of applause.
Thank you very much I'm very happy to be there today, and thank you very much for the invitation. And especially after, I would like to thank again Dr. Alex for the very precise information he gave us, and especially when we're starting to work on the One Health, when we wanted really to better understand the interlinkages between climate change, biodiversity, infectious disease, not only on the human side. And I'm very happy to be there because I'm more also for the field of ecology, but I have the chance to have this new international research unit that has just been launched in the 1st of July in Thailand, joining CNRS, Kasetsat University, and Maidol University, and we are really working on this aspect. So first, I would like to give you some important some data, actually, showing that we are really facing an epidemics of epidemics. When I'm starting to gather all of the data concerning epidemic disease, the last decades, you can see that you have an increase of the number of outbreaks of zoonotic disease or vector-borne disease that are affecting humans, but also, and this will be important because we forgot most of the time this aspect, and I will go before on this, also an increasing number of outbreaks of disease affecting livestock and poultry and affecting the wildlife, the 3 times in only 15 years. Climate change on epidemics, yes, is also already very well known for the past. I will just show the linkage actually between in Eurasia, between East Asia and Europe. Now we have a good modeling and good data showing that the plague and all the waves of the plagues was completely related with the climate and the climate driven, thanks to the work of Niels Stenset. Climate change on human health, so we know also all of this because we have all of these Lancet countdowns, so I will not go on this, just to show that 2001, the report, and showing especially for dengue, but also for cholera, 2021, putting a little bit more on the fossil fuels, and 2033, so putting a little bit more the problem, especially with this kind of maps, and the amount of droughts, which was also completely related with what Alex showed us just before. Just to show, in terms also of vector-borne zoonotic disease, we conducted that several years ago with some colleagues from Liverpool. We tried to understand, doing exploration of the data, especially on more than 3,000 humans or animal pathogen species, and we focused after a little bit, mostly on Europe, and we found that much of the disease were completely related with the climate factors. At least for the zoonotic disease, 35 of the zoonotic disease were already proved to be climate-driven, but a lot of different drivers like rainfall, of course, temperature, but also the particulate matter, the altitude, the moisture, the wind, which may also change with the climate change. Climate change and livestock health. So this is something that we have some data, but not so much at all. But just to remind you, also very important aspect that will change completely, and that are changing completely, our relationship with infectious disease. This is the data from FAO, showing that the increasing number of livestock and poultry on Earth. There were less than 1 billion head of cattle on Earth in 1960. We are more than 1,6 billion, and you see the maps where we have the much higher density. The total heads now is reaching, after the fall with the African swine fever, is re-reaching, and we will pass again 1,600,000,000 of swine. The same, the chicken was a little less than 4 billion in the 60s. Now we are closing to 40 billion of chickens. Also, we see again the importance of the place where they are. So, what is the consequences? But first, we should not say that the planet is dominated by humans. The planet is dominated by domestic animals. The biomass of cattle owners is higher than the biomass of the total humans. And if we count all the biomass of all humans and all the domestic animals, is almost 98% of the total biomass of all vertebrates. And if we are looking at the total heads, if you remember, I told you that the chicken will go now close to 40 billion. The total number of wild birds was estimated at 300 billion in 1997. In 2020, it was estimated at 50 billion. Soon, there will be more chicken on Earth than all the wild birds. These are direct consequences, direct impact on biodiversity loss, because either directly by this, but also by we need to feed all of these animals, so we convert a lot of land to feeding these animals, but also direct consequences about the epidemic, the zoonotic disease, because these animals can be the reservoirs or are very good intermediate hosts to amplify a lot of disease. Say again, for example, the avian flu, as an example. So, and something that is also important, because it's also a support of the food security for humans, climate change and plant health. We have also an increasing, even we have a little less data on this, unfortunately, because we don't have the WHO for human health, we don't have the FAO for the health livestock, we don't have a WAHA for the animal health sectors, we don't have this kind of international organization that can really help to better understand the plant health. But as we can see, we have more and more outbreaks of infectious disease affecting plants, plant health, especially in terms of the plant fungi. And just to recall that it's also the same because we have outbreaks on emerging disease affecting bats or frogs and the fungal disease. Climate change also, in this case, are affecting. We have some data on this. Maybe we should put a little bit more in terms of the simulation and projection of Dr. Alex. But we know that now we can make some prediction about the changing in the security on the emerging of plant disease, especially associated with soil. And this also could be the same for some soil-borne disease affecting humans. Finally, biodiversity. And I would like to join you. We can give information. We have just finished a report for the European Commission on the biodiversity on pandemics. It's really to help the European Commission to develop an agenda, research agenda, focusing also on the policies of the different DGs of the European Commissions. So biodiversity. Against the news is not so good. It's like for the climate change, we are losing more and more species or more and more abundance of individuals. What we knew also that is quite important when we control, of course, with the knowledge and the biodiversity and infectious disease. Actually, there is also a good relationship between the biodiversity loss in the country and the number of outbreaks of zoonotic disease in the country. Something happening in terms of interaction between biodiversity and zoonotic disease, meaning that we are losing an important aspect of biodiversity, not only species that I showed you before, but we lose also the big importance of biodiversity is regulation, interactions, and we lose an important aspect, the regulation of disease transmission that may explain this. We have now also a lot of data. I will not go on this, showing how the wildlife disease are really affecting by some warming event and using several scenarios. That's why, again, it's a good way also to link this data, already existing data, with the new models that Dr. Alex are presenting before. And even on the other way, we discuss about losing species, but actually we are also on the way to lose parasites. And we don't know exactly what will happen in terms of these parasites that are very important in terms also managing the wildlife, is regulating all of this. So we have now some through indication that we are also, the parasite biodiversity is maybe, not all parasites are bad. We need to have some parasites, we need to have some microbes to maintain our living on system. So now I will finish with this. We need to get out of the crisis. And one of these is the One Health approach, and I'm very happy that our chairman is from the WHO, Asia Pacific. And and thanks also from the French and Germany, we have now the One Health high-level expert panel, and I will explain a little bit what is this. It's in November 2020, so we're really starting in 2021, that France and Germany at the Peace Forum had decided to support at this time FAO, OIE, now is the World Organization of Animal Health, and also, of course, WHO, but with UNEP, the United Nations Environmental Program, to create a new multidisciplinary One Health high-level expert panel. So I have the chance to be one member of this panel. So we are 26, and we finish our first mandate, and we renew the mandate, so we will know soon we will be on board again. But what we work is first to give a new definition of the One Health. And I want to give you now, because it's completely endorsed by the international organization, now the quadripartite officially. And it's really an integrated, unifying approach to aim that sustainably balance and optimize, which is important, the health of people, but also with the health of animals, either domestic or wild, and the ecosystem. We mentioned really much the ecosystem health, and to recognize the health of all of these entities, humans, domestic, wild animal, plants, and the ecosystem are completely interlinked and closely associated, and we have to work not only in the intersection, but we have to work at the global level. So, just to say that it's really what we name the 4 C's. We need a better collaboration between sectors and disciplines, from the environment, from the animals, and from the humans. We need a better coordination among societies at the different levels, from local to global, and all of these we need to really implement and to better improve the capacity building into the One Health. So working for healthy ecosystem as a support for healthy humans and healthy animals. And of course, to increase our communication, which is the case today, because we try to make some communication about the One Health. So now, on the second thing, I would not say everything we have done, but very important thing for today, what we ask. We were asked by the quadripartite, but also by the World Bank, especially for the pandemic funds, to define what is prevention and prevention of zoonotic spillovers to humans. So really to think the difference between prevention, preparations, and response. And we wanted to show that we have to shift the prevention really more upstream, while the response and the preparation is more downstream. So I will illustrate that only with this nice cartoon. Actually, it took several ways to discuss among us to accept this cartoon and to finalize this cartoon. So what we can see here, that we have all these preparedness and response that are over there. Preparedness and response is when the disease is already in the community, starting to circulate it. We are there. So this is a really important critical point because we need to have also a good surveillance system, and it's also for the animal side. We need also good laboratory diagnostics, and diagnostic, Pasteur Institute is one of these, but we have also all the livestock the laboratory and all of this kind of laboratory. We need also to develop all the response, the vaccine, the development. We need also to have a good public health, good animal public health in terms of way to sustain and to have a resilient public health system. But the prevention should be much more upstream at really the level of the ecosystem, or what we name the social ecosystem. What are circulating? What are going there? What are the risks there? How to reduce the risk activity, especially to understand this infection dynamics between the reservoir host and the environment. So better also to address the drivers, including the climate drivers, but not only, but also to, in this way, to install a better integrated surveillance at this level that could be really more upstream and to help the surveillance base more downstream. And this is, I would say, develop a One Health surveillance. We develop also, we prevent, but I will not go too long on this. We also work a little bit on what will be the development of a One Health surveillance system with the different steps that we need, and especially the first one is the scoping, the data that we need, the system design, the system governance, the integrated protocols that we need to have, and especially the protocols between the livestock, the wildlife, and the environment, I would say, and on the human side, and after to really develop and implement this surveillance system. So now we are in the way to accelerate the One Health and to really to go on. It's really supporting on this. The quadripartite now have launched this One Health joint plan of action, which is like a kind of a good roadmap. They will release this week the guideline to implement the One Health joint plan of action. And actually, we work as a OLEP member a lot with the quadripartite to help this, and it will be the next step. So finally, the action tracks, we found what was the older One Health approach. Antimicrobial resistance, which was already well implemented in the One Health, and especially the dialogue between the livestock sectors and the animal sectors, and of course the reduction of zoonotic epidemics, pandemics. But now we have several other action tracks, especially better also to integrate for controlling and eliminating zoonotic, neglected tropical disease and vector-borne disease. So we discussed already the malaria, but also dengue and some other disease, vector-borne disease, not only emerging, but still there. And also, which is much more interesting, of course, for me, is how we can better integrate the environment into the One Health, how all these sectors, especially the climate and climate scientists, but ecologists, the people working in the agriculture, in the food system, can really better engage with the One Health approach to really better actually fight and control not only this zoonotic disease, but everything. So we have also, thanks to the development, a lot of climate services. So I will not go too much on this because now we know a little bit better. The World Organization, the World Meteorological Organization are really supporting all of these climate service, and especially for the climate resilient health. And I think also, again, all these kind of modeling approach are very important to readapt, because we need to have adaptive system looking at all these changing global environmental change. We need to adapt and to have the best climate services information for the One Health, and of course, for the human health. And finally, And this is the way that will also work in terms of the several international programs and also supporting by several international organizations like IUCN, UNESCO. I used to work also with them, also with the World Bank, is really to develop a nature-based solution for climate and health. So it is already the case for the greening cities. And greening cities, we develop the greening that are also adaptation or mitigation of the impact of climate change, but it will be also a nature-based solution for climate and health. And especially what we're starting to develop is the urban One Health. And we'll show you that now all the cities in the world that are starting to develop a lot of greening and greening infrastructure. And it's nice when we compare also with the map that are given several maps, maps of emerging disease, map of climate impact. We see that several places where there will be very hit and hurt by targeting by the climate change are also the cities that are develop a lot of urban greenness. So what is important, I will just show you one paper that have been done, but we have several like this, but one that has been done not very far in Taiwan, where they try to understand what are the relationship between the dengue incidents and the surrounding environment of the people. And what they found that actually, if the park and the urban parks are not very good in terms of the reducing the incidents, the green space, and especially the urban forests, are very important in terms of forest, in terms of reducing the incidents. There are several other papers on this that is very encouraging that to develop actually nature based on environment solution, greening solutions, that we can restore biodiversity, ecosystem function, including in the urban cities, but also reducing the impact of climate change and reducing the impact or mitigate the impact of infectious disease. And I will stop you just to say that we will invite some of you to join what we are doing in Singapore just at the end of January, when we will continue to work on one urban health in Southeast Asia. Thank you very much.
Thank you very much, Serge. That is a very, very useful canter through a very complex and difficult subject. Nonetheless, I think your point about multidisciplinarity came through again very clearly, and working from local to regional to global efforts. Clearly, the biomass increase and the loss of biodiversity does make it very important that the Joint Plan of Action have the track 6 on environment in One Health inbuilt into it. That makes it extremely important area. But also the nexus of animal and human health is a critical one, and we've pursued that for decades. I think redefining and refocusing our energy and attention on the critical elements, as you've just described, will remain extremely important. I like the fact that you brought in the issue of urban health into the whole space of talking about biodiversity, environment, and health, because oftentimes we forget that actually most urban settlements are where people are going to live for the next few decades to come. We would have more megacities in our region as well. But I think your point about proactivity in terms of the preventive landscape and how we bring the various international organizations as well as national actors together is an extremely important one. And if you link your talk to what Axel was saying earlier on about the risks for anthropogenicity, increasing vector-borne diseases, I think the message is becoming clearer. What's really comforting, though, is at least there is now some set of actions that we're taking and putting that global effort in place. We've got a few minutes, just about 3 or so minutes, for any questions or clarification from the audience. Let me just look around the room. Any questions for, oh, there we go, Anva.
Thank you very much for a very nice presentation, very comprehensive overview. of the climate change and health. So it seems that we need several coordinating of the actions and with many multidisciplinary. So which organization should be to host this kind of coordination of all the action you mentioned? Because we need somebody that, you know.
I think what we have the One Health quadripartite. So it means that we have these 4 international organizations, so 3 from the United Nations, 2 real organizations, 1 program, and 1 international organization, WAHA. WAHA, the World Organization of Animal Health, I think is very, very a key player, I would say. First, because maybe first it's not a United Nation, so it's not as this big, difficult, and very to navigate it as a big boat. So it's more small boat, can be navigated. They're very adaptable, and I see that because I work with them and several committees for the members, and especially in Asia Pacific. And these are very critical because as they work also for the wildlife, they work also for the zoonotic disease and the animal disease. So they make really the link between the environment and what are doing down by the WHO. So that could be the good key player. We are doing next month. Another way is also all the wildlife supply chain, which is quite very important in the region, so legal and illegal, and to better assess the risk in terms of emerging disease and zoonotic disease. So I think it's one of them, but we can use all. For example, UNESCO with the biosphere reserves are also a good way. I did a MOOC for them on One Health on resilient territories, which is a way also to implement actions to show that really we can build resilient territories while we work both for biodiversity, for development, for education, and for science.
Thank you. And second question is about, to make the move, to make the action, we need funding.
We have two, sorry. There are several international programs that are very important. Of course, the one that is the pandemic fund. So the pandemic fund, I suppose that I follow very far for this, but there are several countries that have already been involved in this pandemic fund. But we have to say they are really on the preparation and the response, not so much in prevention. After, we have 2 big international programs. Alors, as I saw that France and Germany were together with OLEP, and after they re-separate, and so we have 2 big programs. One is PRIZOD, Preventing Zoonotic Infections, so it's mostly the prevention, and we co-start in Laos and Thailand. In April, we will start something really on the prevention. And so we need also more support from the research. And the second one is Nature for Health. So Nature for Health was supported, but is managed mostly by the UNEP, but also with the program, the UNPD. So, and this is also helping the countries to implement a solution to prevent. So this is the 2 actors. After, we have also some other actors, like Zodiac by the International Agency for Nuclear, for the atom, the Atomic International Agency, where they developed the Zodiac program, which is also to help support a better collaboration for laboratory diagnostic, and especially to focus on livestock, and to better share and make the collaboration between the livestock sector, animal health, and human health. So, very shortly.
Fantastic. Let's take just one last question from the lady up there. Yeah.
Merci, Dr. Morand, pour la présentation. My question is, our planet dominated by livestock and poultry, actually, and when biodiversity loss increase, the epidemic increase. So according to your experience, what is the solution?
So I think that's why it's also very great to have that in the joint plan of action, where we have the food security. And really, we have to work on the food system. The food system is really important. That's why I discussed a little bit about the plant health. The food system, which is also the food security, is really under stress with the climate change, with the loss of biodiversity. We really need to work on this. So we really need to have much more on board all the people working on the food system, for the production to the trade, to the international, and to the consumers. And mostly in the cities now, because we are all living majoritarily in cities. Food system, which may after can work on the territories.
Okay. Thank you very much, Serge. A big round of applause. Thank you.